Good afternoon, everyone. My name is Dr. Letizia, and today serves the purpose of introducing my capstone project from the Current Institute Kinetic Theory Teaching Academy, the development of a longitudinal medication adherence curriculum for pharmacy students. Medication adherence may be defined as the extent to which patient behavior corresponds with recommendations from a healthcare provider. Addressing a patient's adherence to their medication regimen should now be viewed as a patient-centered approach in which the clinician promotes collaboration with the patient to build a partnership. The reasons for medication non-adherence may not always be the result of an intentional conscious decision, but rather the result of an unintentional barrier. Barriers such as polypharmacy, complex medication regimens, cost, forgetfulness, interference with lifestyle, physical limitations, health literacy, motivation, mobility, and access to care. Current literature states that adherence to long-term therapy for chronic illnesses averages 50%, with the number of medications prescribed to older people and the complexity of the medication regimens steadily increasing. Because of these pressing statistics, healthcare professionals should become well-versed with addressing medication adherence to help lower patient morbidity and mortality. Pharmacists currently rank as the fourth most trusted profession and are one of the most accessible healthcare professionals. Because of this, pharmacists are ideally situated to positively impact medication adherence. To best prepare pharmacists for this future, specific training on medication adherence should be implemented while in school. Now, current literature demonstrates that activities are being implemented at some point within a pharmacy curriculum to address medication adherence, but it is quite reflective that there is a gap. Most activities are short-lived, fragmented, and not interwoven across a longitudinal progression. Therefore, I sought out to implement a year-long comprehensive approach to introduce medication adherence concepts, create interactive role-playing activities, and create opportunities for students to interact with patients while on their clinical rotations. The primary objective was to develop a longitudinal medication adherence program that strengthens the student pharmacist's comfort and aptitude to provide patient care services related to medication adherence through the development of empathy, care, and motivational interviewing skills. This program will be delivered in 4 phases and occur within the patient care laboratory and while on their clinical rotations. Phase 1 occurs from July to August. During this time, we provide students with a personalized mock prescription of a complex medication regimen and instruct them to take the placebo medication each day for 30 days, all without providing any prior knowledge on medication adherence. After 30 days, students return to lab. We then collect their medication vials for pill count information and have students complete an online medication adherence survey, both of which are intended to collect quantitative and qualitative data. We now introduce students to the concept of medication adherence. Afterwards, students are again instructed to take the placebo medication for another 30 days, but this time with knowledge regarding medication adherence. After 30 days, students return, and we collect the same qualitative and quantitative data to have pre- and post information. Phase 2 occurs from October to December. During this time, students actively observe and reflect upon how medication adherence is addressed for patients in a community pharmacy while on their clinical rotations. Students are then asked to formulate a plan of action on how they would improve these processes. Phase 3 occurs from February to March. During this time, students are introduced to the concepts of motivational interviewing, practice conducting brief interventions as they relate to medication adherence, and create their own good and bad video examples. Phase 4 occurs from April to June. During this time, students actively work with patients while on their clinical rotations to put their skills into action. Activities are now created to have students conduct brief interventions with patients to help improve medication adherence. During the 2019 to 2020 academic year, educational activities were tested in each phase to determine the feasibility and practicality. During this next academic year, research will now be conducted to collect data. Qualitative data will be collected through analytical coding of student reflections, and quantitative data will be collected through pill counts, validated surveys, and scales. In conclusion, during the experimental phase, I have acquired a much better understanding regarding how to deliver these educational activities in a meaningful way to students that is valuable to them, all while incorporating character, caring, and competence. I firmly believe that this curriculum will help students provide better patient care services related to medication adherence through the development of empathy, care, and motivational interviewing skills. During this time, I was curious on how I might implement educational activities during lab that also translate and transform their knowledge to skills into abilities while working with patients. Also, I was curious on how to gather qualitative and quantitative data. I made connections with students, mentors, and faculty to best implement during the experimental phase. In the future, I will need to connect with the IRB. Both positives and negatives during the experimental phase helped improve processes for this next academic year, and I could not be more excited. Thank you, everyone. I hope everyone has a wonderful rest of the day. Here's my character artifact, my two cats, Elvis and Lucy.